As I said, sometimes we're going out to outreach, but we need to know the limitations of where we are going. We need to pick the right patient for the surgical location and for our own expertise. We need to identify patients who require physician and referral, pick the right plan for the patient and the surgery, anticipate difficulties and have alternate plans, plan A, plan B, plan C. I cannot overemphasize this. Watch your tube at the connections. Watch the surgeon and watch the surgical field. Ensure that the throat pack is out. It is a team responsibility, but at the end, we are taking the educated tube out, ensure that the throat pack is out, and aim for pain-free post-operative period to facilitate. Thank you very much for your attention. This is also one of our marathon weekends. And since I'm sure we'll actually participate besides just taking selfies. Thank you very much for your attention, and thank you for inviting me to lead this lecture.
Thank you very much, Professor Desalu, for that very detailed presentation on comprehensive care, the role of the anesthetist. I thoroughly enjoyed it, and I could see from the audience I was very well received. Professor Desalu spoke to us and told us that the anesthetist is a key team member in the comprehensive cleft care, and that there are different aspects of cleft care. Not only cleft lip and cleft palate repair, there's also alveolar bone graft, there's speech, there's nutrition, and there are regions, showed us regions where Smile Train has partners, and there are some few centers that provide this comprehensive cleft care. She mentioned the peculiarities of cleft patients, called airway, and presentation for multiple surgeries. She also mentioned preoperative care, that is very important to review the patient as close to the surgery time as possible, because things may change. And then she emphasized thorough airway assessment, respiratory assessment, cardiac assessment, and advised that uncorrected major cardiac defects should be deferred. Patients with uncorrected cardiac defects. She mentioned the importance of hands and feet in these patients. She mentioned the complex cleft patient, and as such patients must be treated in a proper hospital. They should not be done as outstation cases. And the anesthetic plan must be the right one for the surgery and for the patient. And she emphasized that retained throat pack is a never event, and throat pack is everyone's responsibility, not just the anesthetist. And we're to monitor mouth gag time. We should not allow it exceed 90 to 120 minutes, otherwise edema may result. And she mentioned also the usefulness in the postoperative care, the usefulness of nasopharyngeal airway in selected patients. Thank you so very much, Prof.
We'll be moving over to the next plenary lecture, which will be delivered by Dr. Tonia Onyeka. It's a virtual presentation, and it's titled Anesthesia for Cancer Care, an Opportunity to Improve Outcomes. Associate Professor Tonia Onyeka's citation will be read by Dr. Rosemary Okorie. Dr. Rosemary Okorie, are you around, please? Change in plans. It will now be read by Dr. Charles Appen.
Good morning. Good morning, all protocols observed. My name is Charles Appen. Thank you. I'm taking the citation for Professor Tonia Onyeka, Association for Hospice and Palliative Medicine, AAHPM, and the International Association for the Study of Pain, AASP. She was a member of the Technical and International Association for a Technical Expert Group, TEG, that produced the first ever pain management guidelines for Nigerian healthcare professionals in 2018. She's a principal investigator for nationwide pain e-training of the Nigerian medical undergraduates and is an associate editor of pediatric pain section of the journal Frontiers in Pain Research.